It's been 9 months since Sharon Regional Medical Center opened up after closing down in January following Stewart Health Systems bankruptcy. The hospital, now called Sharon Regional Health Systems, is under the ownership of Tenor Health. As this hospital approaches its 1-year anniversary of being open again, we are talking now with the VP of Decision Support for the Tenor Health Foundation, Casey Fatch, and the interim CEO of Sharon Regional, Todd Tomalunas, for an update on how that hospital is doing. Thank you for joining us. Casey, I want to start with you. In the past 9 months, what have been the biggest challenges the hospital has been facing?
Well, I think when you look at any initial startup, first of all, this has never happened in the state of Pennsylvania before. There's never been a hospital that's reopened after it's closed. So there's a lot of moving parts, a lot of heavy lifting. It's just like any other business. When you have initial growth in a startup, you've got a lot of expenses that outpace your revenues, and so that's been a challenge. But we're turning a corner on that. And probably some of the other challenges have been, basically labor, trying to find staff, and that's nationwide. That's just not unique to here.
And Todd, on the other hand, what have been maybe some of the areas of the biggest improvements?
Well, honestly, I started this past Monday, so from what I can see is just purely getting it back open and getting the staff connected. I see a lot of engagement from the team, the physicians, and the staff in general. So I think that the excitement is what's going to pull us through the future.
And where have
Todd,
where have you seen maybe some of the most growth? I'm curious, patients are coming back, getting to know the system again.
Well, again, my personal belief right now is in a short time I've been here is ancillary growth. We have a lot of access in our imaging center, radiology, and some of our lab services we can expand. But also, I think Casey can speak to some of the subspecialties that they've been working on to enhance the service lines.
Yeah. So, unfortunately, when the hospital closed, the STEMI program went away as well, and so that's basically how we treat heart attack patients. And those patients were being taken to Jamison, which is a pretty far ride. And you got to remember, when you're having a heart attack, minutes matter. You need to go to the closest hospital possible. And so we just recently opened our STEMI receiving center. We got certification from the Department of Health, from the Commonwealth. And we have basically done about 17 procedures for a heart attack and about 6 interventions. And those are people that would have had to drive at least a half hour in an ambulance. And that, once that muscle goes, it never comes back. So you need to get to the closest place, and that's us.
Yeah, every second counts. And I'm curious, Casey, were you able to retain a lot of the staff from before when Sharon Regional closed in January, or are you still working on hiring and filling jobs?
We did. One of the requirements of the purchase is that we funded Stewart's Warren liability. So we kept all the employees on payroll. Nobody was let go, and everybody was compensated for the 6 weeks while or actually for almost about 6 weeks, 7 weeks while we were in transition and trying to open.
Now, we know there were plenty of residual financial hurdles from Stewart Health's bankruptcy that made reopening a challenge. And I'm curious, because how has Sharon Regional been able to move forward, keeping its doors open, while Insight and Trumbull has continued to see financial problems? Would you say your challenges are different?
No, I would say, fortunately for us, we had a team intact, right? We had employees still here. We had a management team still here. And I think the difference with Trumbull is they were closed for a while and all the employees got other jobs. And that makes it very difficult, especially in a market like that in Warren.
And real quick, any expansion plans or anything that you're going to add in the new year?
We are looking at an infusion center and getting that up and running so patients don't have to drive for infusions. We'll be doing biologics and some of the general medical infusions, and then we'll have a big announcement coming up probably the second quarter of next year, where we're going to be reopening a cancer center and partnering with a major health system so people don't have to leave the area for cancer.
Well, that's great news. Thank you so much for joining me ahead of the holiday. Casey and Todd, thank you so much for taking time.
Thank you.
Thank you. Have a good day.
Bye.